Know that millions of women are living with crippling pain, fatigue, and heavy periods, often without a diagnosis? Today we're talking about two conditions that are common, serious, and massively misunderstood: adenomyosis and endometriosis. If you've ever been told your pain is normal, or you're looking for answers to symptoms doctors keep brushing off, this video is definitely for you. Make sure you hit like, subscribe, and stay with me, because by the end of this video, you'll understand exactly what these conditions are, how they affect daily life, and why raising awareness truly saves people years of suffering. Adenomyosis is a condition where tissue that looks and acts like endometrium, the lining of the uterus, grows into the muscular wall of the uterus. Imagine the uterine lining burrowing into the muscle, causing the uterus to become enlarged, tender, and extremely painful. Common symptoms include very heavy periods, severe cramping, pelvic pressure or bloating, pain during intimacy, chronic fatigue due to blood loss, and in some cases fertility challenges. What makes adenomyosis particularly frustrating is that it's underdiagnosed, often mistaken for fibroids or dismissed as bad periods. Diagnosis usually relies on MRI or transvaginal ultrasound, but even then, many people go years without answers. If this sounds like your experience, stay tuned. You are absolutely not alone. Endometriosis is different, although it often happens alongside adenomyosis. With endometriosis, tissue similar to the uterine lining grows outside the uterus entirely. It can appear on the ovaries, fallopian tubes, bladder, bowels, and in rare cases, even the diaphragm. This tissue reacts to hormones every cycle, causing inflammation, internal bleeding, and scar tissue. And that leads to some of the most debilitating symptoms people experience. Symptoms of endometriosis include chronic pelvic pain, painful periods that knock you off your feet, pain with bowel movements or urination, pain during intimacy, nausea, bloat and digestive issues, fertility struggles, full body fatigue and inflammation. And here's the shocking part. It takes on average 7 to 10 years to get a diagnosis. Not because it's rare, but because pain is normalized, dismissed, or misdiagnosed as IBS, anxiety, or simply women's issues. This is why awareness matters. Adenomyosis and endometriosis are different, but they can absolutely coexist. In fact, many patients have both. Why? Because both involve tissue behaving abnormally in response to hormonal signaling, but in different parts of the reproductive system. Key differences. Adenomyosis equals inside uterine muscle. Endometriosis equals outside the uterus. Adenomyosis often causes heavy bleeding. Endometriosis often causes widespread chronic pain, but both conditions can lead to inflammation, pelvic pain, and fertility challenges, and both can drastically affect quality of life. Let's talk real life. Because adenomyosis and endometriosis aren't just painful periods. They affect work productivity, mental health, relationships, exercise and mobility, intimacy, energy levels, daily functioning. People miss school, lose jobs, or get labeled dramatic or unreliable. Many learn to hide their pain just to be believed. And that's why awareness is so powerful. It helps people recognize symptoms early, advocate for themselves, and push for better care. Something that doesn't get talked about nearly enough is the emotional impact of adenomyosis and endometriosis. Chronic pain affects so much more than the body. It can affect identity, confidence, and mental well-being. Many people describe feeling isolated because friends, family, or even doctors don't understand the severity of their symptoms. It's not just the physical pain. It's the constant worry, the fear of flare-ups, the frustration of cancelled plans, and the exhaustion of advocating for yourself over and over again. Living with a condition that is invisible to others can cause anxiety and depression. You might look fine, but internally you're battling constant discomfort. And that mismatch between how you feel and how you're perceived can be incredibly draining. That's why mental health support is just as important as medical care. Whether it's therapy, support groups, journaling, mindfulness, or simply having one trusted person who believes you, tending to emotional well-being is a form of treatment too. While there is currently no cure for adenomyosis or endometriosis, there are treatment options that can help manage symptoms, and everyone's path looks different. Treatments may include hormonal therapies to reduce heavy bleeding and flare-ups, pain management strategies, anti-inflammatory approaches, physical therapy for pelvic floor dysfunction, iron supplementation for heavy bleed fatigue, and in more severe cases, surgical options such as excision for endometriosis, or hysterectomy for adenomyosis. But here's an important note. Treatment is highly individual. What works for one person may not work for another, and sometimes, finding the right combination takes time. And that's okay. The key is having healthcare professionals who actually listen and treat you as a partner in your care. Let's talk about something a lot of people are afraid to ask but desperately want to understand. Fertility. Both adenomyosis and endometriosis can impact fertility, but it doesn't mean pregnancy is impossible. With endometriosis, inflammation and scar tissue can affect the ovaries, fallopian tubes, and pelvic environment. With adenomyosis, the muscular wall of the uterus can become thickened and less receptive to embryo implantation. But many people with these conditions do go on to conceive naturally, or with support. Fertility is deeply individual. Some people never experience difficulties, while others need a bit more help, and that help can look like hormonal support, IVF, or laparoscopic surgery. The key thing is knowing that fertility challenges are not your fault, and seeking specialist guidance early can make all the difference. One of the biggest questions people ask is, why does it take so long to get diagnosed? And honestly, it's a mix of outdated assumptions, limited training, and systemic gaps. A lot of symptoms overlap with other conditions like IBS, fibroids, pelvic floor dysfunction, or hormonal imbalances. Pain is also highly subjective, and for decades, menstrual pain has been dismissed as something people should just get on with. Imaging isn't always definitive either. Endometriosis often requires laparoscopic surgery for confirmation, and adenomyosis may only show clearly on MRI. So it's a combination of clinical intuition, patient history, and persistence. This is why self-advocacy matters so much. When you understand your symptoms, track patterns, and speak up confidently, you help guide clinicians toward the right investigations sooner. Here's something powerful. People with adenomyosis and endometriosis often become some of the strongest advocates for their own health. You learn to ask questions. You learn to say no when something doesn't feel right. You learn to push for referrals, imaging, second opinions, and better care. And that's not being difficult. That's being empowered. The more we raise awareness, the more we normalize speaking up, and the more we help shorten the diagnostic journey for the next generation. Every conversation, every share, and every story matters. Here's the truth. The earlier these conditions are recognized, the earlier someone can get help. Awareness leads to earlier diagnosis, better treatment options, fewer years of silent suffering, more research funding, greater understanding in workplaces and schools, empowered patients who know their bodies better than anyone else. And most importantly, it reminds people they're not alone, their pain is real, and they deserve proper care, without dismissal. If you suspect you might have adenomyosis or endometriosis, here's what you can do starting today. Track your symptoms. Don't minimize them. Bring your notes to your GP or consultant. Don't be afraid to seek a second opinion. Ask for imaging if needed. Connect with support communities. Learn your body's patterns, and advocate fiercely, because you deserve relief, answers, and a plan. Thank you so much for watching. If you found this video helpful, hit subscribe, share this with someone who needs it, and drop a comment telling me your experience or questions. Awareness starts with conversations, and you just helped make that happen. Before we finish, I just want to make something really clear. Everything I've shared in this video is for education and awareness only. It's not medical advice, and it shouldn't be used to diagnose or treat any condition. Everybody is different, and everyone's symptoms and medical history are unique. So if anything in this video sounded familiar, or if you have concerns about adenomyosis, endometriosis, or your menstrual health in general, please speak to your GP, gynecologist, or another qualified healthcare professional who can give you personalized guidance.